Okay, you can't hear me? You looking. You can't hear me? Oh, God. Okay, Imma come out and come back in. Hold up. Can you hear me now? Can you hear me now? Okay. It didn't have a little circle. Oh Lord, that's part of the church announcements. It didn't have a little circle, so I couldn't see whether or not you can, but I can hear you. Are you okay? Like, sir, don't do that. Good morning. Oh goodness. Okay, I'm sorry. I didn't realize it didn't have a little circle and good morning. Hey, Asha, how you doing? I had not it's so many different features and stuff I'm completely lost. I'm gonna have to take a whole day seminar on understanding all of the Clubhouse foolishness. But anyway, good morning. Yes. Okay. Let me see. Uh, you still got it? Ooh. Yes, still there. I hear it's not as bad. Okay, let me see. Playing around. Okay. All right. It's still there, but it's okay. Okay. It's not bad. I'm sorry. That's all right. Don't hear. Good morning. Oh. You said don't hear it with me, but they hear it with you. Really? Okay. I don't know. Okay. I'm listening. Look, can I hear anything? Okay. Well, good morning. Good morning, everybody. Good morning. Good morning. And welcome to our Saturday morning tea, where we discuss health information, news, education, certification tips, entrepreneurship, foolishness, just all of the things in the healthcare space. I am Clarice Warner. I am the Girl with the Pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. We're located here in Cincinnati, Ohio. We are a healthcare consultancy that helps you with pretty much anything that you need done in your revenue cycle needs. And let me just ask the question and put it out there to those of you who are not familiar with medical coding and health information and all of those things. Do you know what it takes to be a certified marketable medical coder? Do you? Do you really? Well, before I introduce my co host, let me share with you information on a free email course on the 5 steps to become a certified marketable medical coder. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. All right. Oh, see, you caught me jamming to the music again. It doesn't take much. In Clubhouse, feel free to click the link if you are interested in getting more information about the free 99 email course on the 5 steps to become a certified marketable medical coder. And if you are joining us via YouTube, Facebook, and or LinkedIn, then you can find information regarding the free email course in the video description box. I promise you it's down there. It's a lot of stuff in there, but it's down there. I promise you. I promise you. So joining me today is my illustrious co-host, Mr. Jesse, the registered trademark. Put some respect on my name, the coding nurse. Sir, introduce yourself and tell the folks all about you.
Good morning, everybody. My name is Jesse. I live in Philly. I have been in nursing for a long time. I transitioned into HIM in 2014, and during the pandemic, I created a company called the Coding Nurse LLC, where I help other nurses and other people in healthcare with a clinical background to transition into the wonderful world of HIM.
And isn't it a wonderful world? Isn't it a wonderful, wonderful world? So how are things going?
It's coming along, but I don't know. It's like I just become. It feels like I'm just like so many people don't know how to get into it because it's a broad field and people just don't know where and how to find their lane, and it's just a lot of misinformation out there. It really, really is, and
You're
I find that so interesting and sad at the same time.
Yeah, I feel you on that. I feel you because I think oftentimes people are so one pathway versus another pathway. They get into it and realize this is not what I wanted to do. I wanted to do something else. And so I don't think folks are given to your point, enough information about all of the options and all of the things that they can potentially go into as it relates to health information. And then they become discouraged and disheartened and want to hate the field and want to have bad thoughts and bad comments and all of the things when I think really is just a matter of, getting all of the information. And then sometimes they also have to take ownership as well and do their own research about what's happening or what is available too. So I think it's a
But you,
mismatch of both.
but I think it's like it's easy for us to do research because we know number one barely. We know how you have people who don't know anything. They just go by what they heard.
Well,
And they don't know step one about how to get a certification, what's even required to get a certification. Because what I've really noticed is like our industry does not advertise. You can go to there's 1,001 advertisements to go to school to be a medical assistant, and they talk about what you do. They talk about how it's such a wonderful thing, which for some people it is. But HEMA doesn't really advertise. AAPC, you advertise, you'll get stuff if you've been to their websites and you have your cookies.
that's what I mean. That's what I mean. A very cursory um Google search medical coding. And often you will find AAPC, you will find AHEMA. So you're right. They don't do a whole lot of advertising from an organizational perspective unless you're already in the loop. But just to, what is medical coding or what is, I'm talking a very basic, broad, cursory research for folks who may be interested in the field. That's all. Now the deep stuff, yeah, you may have to get some more and do some deeper. But once you um connect with the organization, they're gems all throughout. I mean, they provide you some information, and it can be overwhelming. Don't get me wrong, it could be overwhelming if you're brand new and you have no clue, no idea, no this, that, the other, and you picking up all the gems and then you can't move because you didn't pick up all the stuff and don't know where to do with it because it's all heavy. But that is a start. So at least you have a basic understanding or basic knowledge about the profession, and you know can reach out and ask some questions. Hey, are you certified? Are you this? Well, what certifications are you, and this, any other, and tell me a little bit more about that. I mean, so you can begin to have those conversations. So I think it goes both ways. And I do see, well, them commercials in the middle of the day and late at night that says, "Do you want to be a medical biller and coder?" That don't get me started. But okay, some of those schools that have the advertising dollars to do that, um, they're kind of putting the profession out there, but not. Okay, I'll let that go for now. Ah, all right. So before we jump in, let me remind you, if you are on Clubhouse and want to join in and add to the conversation, please raise your hand. I think that part of this is still the same. Don't be shy. Your opinion matters, right? And is welcomed here. Because we're gonna talk the talk. For my Facebook, YouTube, and LinkedIn friends, you all know what to do. You use the chat, and That's how we have wonderful, wonderful conversation and dialogue. And I do see a couple comments that I'll check out in a minute. But if you have a question, if you're using the chat function, please put a Q in front so that we know it's a question and we don't miss it. Okay. You know, I'm speaking all of that in existence when we have millions of chat and it's just flowing, 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 and we can't keep up. So if we get everybody into the habit of doing it now, we'll be good. All right. Church announcements. So let me put my banner. Church announcements. Okay. So the first church announcement is Clubhouse has gone all over. It's gone rogue. Let me just say that. I'm learning that they've changed a whole bunch of stuff in a week. It's just been a week since I seen y'all. What is happening? So I need to go back and read some of these Clubhouse chronicles to get a better understanding of my new house that I have. I guess that's what it's called. And like even to schedule, it was a total different thing to schedule. I don't even see where I can add you as my I gotta go back and find. That's why you wouldn't automatically linked, Mr. Jesse, to the thing. I have no idea. So I need to do some research. I thought I could just do what I normally do. Let me jump on and schedule. And I looked this last night like, well, what? This is different. All of the things are different. So I have to do some research and I have to do some additional digging to figure out what in the world is happening. Okay. That's my church announcement. Do you have any church announcements, sir?
No.
Okay. Well, look at you.
I'm ready to dig in.
I know you are. Okay. Okay. Well, good morning. Good morning. Asha Stranger, where have you been, ma'am? Good morning, Vicky. How are you? Good morning. All right. So, as you probably know, this past week was Health Information Professionals Week. And so, for those of you who are just joining us, today we are going to unpack the HIP Week happenings. HIP, of course, stands for Health Information Professionals. And there were a lot of things that were happening, believe it or not, within the world of HIM. Mr. Jesse, did you all kind of celebrate and do all of the things in health information in your organization?
I got an email, but in terms of my department, there was no recollection because I don't know. Just in my opinion, I don't think they see themselves as part of it, even though it is.
Really? Oh, well, because of the whole, oh yeah, y'all special.
Yeah.
I know, y'all special.
So they think.
Oh, here we go. Make sure my tea is hot. Okay. So Health Information Professional or HIP Week is April 17th through 21st. And I hate that we weren't here together because I would have posted a bigger push for folks' recognition about the week last week. So AHIMA was proud to celebrate health information professionals, and they do this every week. And during this week, they encourage health information professionals and their organizations, and their organizations to join them in raising awareness about the health information profession and recognizing health information professionals' valuable contributions to healthcare. And their theme this year was Health Information Powers Innovation. So, one of the things that we got, and if you are a member, I think you got this in an email, but there was a video from our she's president. Let's see, there's a whole video. So let me see if I can share this video. Hold on. Share screen.
Welcome to HIP Week. AHIMA sets aside a week every year to celebrate you and the superhero role you play as a hip star. Let's celebrate together and pay tribute to the vital and difficult work you do every day, the value you bring to your organization, the critical role we all play in every patient healthcare experience, and how essential our work is during this time of breathtaking evolution in healthcare. Our theme this year is Health Information Powers Innovation. And our superpower is advancing innovation while ensuring that data remains accurate, complete, accessible, and protected for every patient. We encourage you to use the toolkit on our Hip Week website to bring the festivities to your organization. You'll find ideas for events, social media posts, infographics that tell our story, and some really fun swag at the Hip Week store. Congratulations, Hip Stars! Take some time to celebrate you and the meaningful work we do empowering people to impact health.
All right, all right. So, uh-oh, no, okay. All right, all right. So, do you feel like a hip star? I said hip star. Wait a minute. That's new. That was a new start for me. Um, so all of that, I got that information via email, and I also received information from our local, or not our local, our state organization. So everybody was kind of doing a little push, and you got everything on Monday, and then it was like crickets the rest of the week. I was like, well, it is a whole week, right? But for whatever reason, folks just didn't continue. But then we got a real email also on Monday, um, regarding our organization. And the first thing I thought was, well, why during Health Information Professionals Week? But let me just share. So if you didn't know, we have a new interim CEO of AHIMA. So the board of directors has nominated Amy Mosser to be the interim CEO of AHIMA. This is a result of Dr. Wylisa Wiggs Harris's decision to resign as CEO. This change will go into effect on June 9th, 2023. And we are now beginning the process of finding a permanent replacement. This came also from Jennifer Mueller, who is the president and chairman of the board of AHIMA, who you just saw on that video. The board and I are confident that Amy is the right leader to ensure that AHIMA continues to execute on its strategic plan and deliver on its promise to its members and other stakeholders. She has been a critical member of our executive team for the past 4 years and will provide continuity and be the steadfast leader AHIMA needs during this time of transition. She would like to thank Wylisa for her last 5 years of service to the organization. AHIMA has made tremendous strides under her leadership. She has laid a solid foundation for our continued growth. And then she says, please join me in wishing her every success in the future. So for me, first of all, it came out of left field. I was like, wow, okay. But the concern, I guess, it was, why do it during Hip Week though? I mean, and maybe that's part of that is some of the reasons why you didn't see a lot of hoopla. I don't know. What are your thoughts on that, Mr. Justin?
I really wasn't too concerned because the bottom line is like none of them do anything. It doesn't matter who the head is; it's all effed up, so it don't matter. Honestly, it doesn't because they don't do anything. They don't. I mean, if you're really trying to uphold your profession, if you're really supposed to uphold all the tenets, and he has a whole bunch of stuff that they supposedly abide by, but where's the action? I don't see any. I don't see where our profession is getting any better. We have a whole bunch of incompetent people who call themselves coders in this industry. And there's no accountability, there's no nothing. And I work with a bunch of them.
So whose responsibility? So, okay, let's take it to the incompetent coder piece. So whose responsibility is it to monitor that or check that?
The people who certify them. What I think needs to happen now is I think that it needs to be, I think they need to go back to, and I know a lot of people hate this, but coders need to recertify. And when I say recertify, take an exam every 2 to 3 years to keep your certification. That will weed out all of that.
And there are other professions that do that. Do they do that in nursing?
Yeah. They do it in physician assistants. I think it's every 7 years they have to do it. Because there's too much at stake. And these people are just out here running amok.
Not running amok. Okay. Well, that is a thought. That is a thought. But don't you also think that those who are employing these coders should also have some skin in the game? Shouldn't they make sure or be responsible that the people that they're hiring are also skilled with the knowledge of the job that they're doing?
But how can they tell? And first of all, you should be able to supervise anybody who did not certify yourself. So if you're a coding manager, you would have to recertify too. So everybody in the loop should know.
Well, I'm thinking above manager. I'm thinking whoever is over the entire department, taking ownership and making sure that their folks can do the job that they were hired to do, and maintaining the credentials and the skills to do it.
Well, that's what they call themselves doing now, and it's not working. So it still all goes back to everybody needs to recertify, because the chief of staff is still a doctor. There's a standard that doctors uphold that should come from the top down. See, that's the problem. The problem is they're trying to change from the bottom up, and it's never going to do it, because it's never going to happen, because people are going to stop it, because they're uncomfortable, because it encroaches on their territory. And they make them come out of their comfort zone, because there's no problem in admitting you don't know something. Just go find out.
That's true.
You shouldn't have to, like, I'm just amazed at how much money is actually wasted in healthcare. It's just astounding. And I just see it on my end. But if you extrapolate that across this huge country, I see why Medicare and Medicaid recoup billions of dollars in overpayments. I see it every day.
But this is not new. This has been going on for decades.
Right, but there has to be a change in order to stop it from going on for decades. Like, somebody has to do something. And it starts with accountability. It starts with, okay, can we be very clear? Like, it's very easy to pluck some CEUs to recertify. That ain't hard. You could take the same CEU over and over and over and over. It doesn't mean that you're challenging yourself. Doesn't mean that you're learning anything new. Doesn't mean that you know the guideline. Doesn't mean any of that. And I think, carrying it out to other professions, nursing is the same way. Every industry is the same way, because they have gotten out of control, because nobody has ever tried to reel it in. And it has to be across the board. And people are afraid of change, and they don't want to rock the boat. They got to be positioned. It's nice and cushy. I can make it look good. I can have somebody type up a nice little response, and I can act like I'm doing something, and then things still stay the same.
That's interesting. That's interesting.
See, that's my problem. That's why, like, employment has never been for me, because I want to see some real results. Like, I could care less. If I have a job to do, I'm going to do my job, and everybody should be on the same page. If 2 and 2 is 4, 2 and 2 should be 4 on Monday through Friday. Not well on Friday it could be 5.5.
Yes. So I hear you, because there's a lot of gray ambiguity and uh changes that are made based on individual scenarios, I guess, if you will, that is never communicated. So, say, to your point, on Friday, well, now 2 + 2 is 5.5, but nobody else knows that, only the people that are involved in that, but everybody else still believing that 2 + 2 is 4, and they're continuing to move on that way. So again, I think just, yeah, making sure, I think we talked about this too. There's a huge communication problem in disseminating of information in our profession. But I think just period. Just period. So that's interesting. That's interesting. So my T levels are telling me that they just done got on your nerves this week, right?
It's just what I find astounding is everywhere, because everywhere I go, I see the same thing. That's why I stopped going. Because it's the same thing over and over and over, and it's like it's sad. It really, really is. It's sad because it's very clear that and all of them, and part of this is, I'm going to do a roundhouse kick. Part of this is all of what I say on here darn near weekly is gatekeeping. If you stop with the girlfriend network, maybe somebody would know something. Because all y'all did. You and your girlfriend.
Oh, Lord. Yeah, you're absolutely correct. You're absolutely correct. I mean, but what can we do? So, I'm about, and I get the gripe. I get the bringing awareness to the situation, but what's the next step? What do we do? What can we do? What can we offer? How can we help?
It has to be the organization who certify these people, because my best friend, her mother has been an HIM, and she's the head of the VA here in Philly, and it's a big one. And she has the same complaints with her coders, and how much education they have to pour into them because they just don't have it. And where did you not get it? And why are you walking around here not getting it? Why are you walking around here certified and you don't know guidelines? Like, how can that be?
But so how did they get the job?
But first of all, like, a lot of jobs don't have tests. And then I can speak from experience, a whole lot of tests aren't really reflective of what you really truly have to do. Because if that was the case, I think that there needs to be a revamp all across the board.
But even if your assessment doesn't do that, having the conversation during your interview, at some point, as I'm talking, let me walk that back, because you may not have a person who is well versed in what they do, being the person who is hiring or the manager or whatever. So it's a bigger, okay. Because I would think you would have that conversation, because it only takes a conversation for folks to understand you don't know what the hell you're talking about. True. Oh, we got a question. Barbara says, I thought coders were required to recertify every 2 years and turn in continued education with the AHIMA certification.
You can listen to a webinar and get a CE. That don't mean you learned the thing.
And oftentimes there isn't an assessment after that webinar. I mean, but if there is something like that, you don't. I mean, who gets it? You don't submit that assessment. You could have failed the assessment. It don't matter as long as you went to the webinar.
But remember when AHIMA used to give you an assessment?
They did. I remember, especially with my CCSP, we had every 2 years you had to complete that whole. Or no, Yeah, every 2 years you had to complete that assessment, and if you didn't pass it, then you had some problems with as it related to your certification. It wasn't for the bigger one, but it was for specifically for the coding one. They did have that. You're right.
Exactly.
But
they stopped it.
But they did away with it.
Right, and that assessment, it was, you had to think about it.
I thought it was very fair, and what I loved about that assessment was it focused. It was a wonderful mix of some of the key things that and challenges that people run into with ICD-10 as well as CPT, but then also an influx of new information and new changes. And so it made you have to understand, well, what are the new changes? You could not operate or pass that exam successfully without knowing what new changes were coming down the path. And I loved that for that. That was a great, I love that. Exactly. You had to know.
Exactly.
You had to know. And I think for me, I think it also enhanced not only your coding skills, but it also enhanced your research skills. It also enhanced, you going out and doing some additional learning regarding these things. So you couldn't just operate in, oh, well, I work in primary care and I just see these same people all the time and it's just the same thing day in, day out. No, you still needed to keep yourself in line with what was new and current in the profession. You couldn't just pigeonhole yourselves. They were forcing you to actually know what was going on. And I love that. I don't know what happened to that. Well, I don't know what happened to that. I think it was a bottom up rah-rah they wouldn't happen.
I think people were complaining because they couldn't cut the mustard. And they made enough noise and they stopped it. But you have to, if you call yourself a coder, you have to know how to code.
You got to know how to code. Barbara Ann also said, yes, every 2 years, no longer. Makes sense. There are incompetent coders out there now without that check and balance. I don't think AAPC ever had that, though.
No.
They never had that.
But the thing is, like, it's always information out there, but people have to choose to use it.
True.
And AAPC needs to, because like what they do, like they have their monthly magazine where you can, if you just leaf through the magazine, you can ask some questions at the end, and you get one CEU because you have to take I think it's like 20 question quiz, and then you get like like one CEU per monthly magazine. So but it has to translate into knowledge and actionable and demonstration of that knowledge that you actually learn something. You can't go back to, because it doesn't, I've just seen it too many times and I've seen it everywhere I go. So it's not just one particular organization. It is just really across the board. And I can honestly tell you, I only worked one place that was not like that, because we had to take assessments and pass them all the time. And that was, I talk about them all the time in Novaline. They had made me the coder and the auditor I used to be. Because when I tell you, they were some taskmasters. But
do they still do that? I mean, or I don't know if you're connected with anybody okay. So, I mean, and again, organization by organization, maybe that's where it starts, I guess. Maybe if your organization was really serious about making sure the reimbursement that comes in stays in, you would take those necessary steps to make sure that people were skilled with or were able to do the tasks that they need to do within that revenue cycle, specifically with your coders, and making sure that they understand or provided the knowledge, or, I mean, that's an investment. So those organizations would need to invest in those people that they felt were qualified enough to come into their organization and do those jobs. So once you got them, you know, you gotta you can't just let them be out there in the world. You gotta keep them close. You gotta train them. You gotta provide them with information. You can't just assume. I mean, you would hope that they would take the initiative, but if not, it's your business and you want to make sure that it's thriving and viable. So you need to make sure that you are providing the folks with the information that they need to do the jobs they need to do. Or you're going to run into people like Mr. Jesse, and he's going to talk about you.
And I'm talking about basic concepts. And like, because you have, and you also have, it's just, HRM is just so fascinating. Because by being so broad, everybody gets to have a piece of it. And it's just so interesting how that works. So everybody has a piece of it, but they don't have to have this other piece. Like, because I think everything in healthcare centers around coding. I have long thought that everybody in healthcare should at least have, and I'm not saying you need to get a coding credential, but you need to be exposed to payment methodologies. You need to be, and I think that needs to be taught in nursing school as well, because they don't teach you to have any kind of regard to payment. But healthcare, period, wherever you are in healthcare, you play some part in the revenue cycle. And that needs to be taught, like from the security at the front desk to who scan you in to the orderly that wheels you out when you're discharged. All of those people play a role in the revenue cycle, and it's not taught, and people don't know where they fit, so they don't know how to improve, because they just think that they're just going around willy-nilly. And that's really the problem. And then you have these people who, are in the revenue cycle, but they think, well, I don't have to do that, or that's not my my job. But when your job is tied to DRGs or APR DRGs or APCs, that is your job, because you're talking about money now.
I'm on the fence on that one for a couple of reasons. I mean, I think a cursory introduction to understanding the payment methodologies is warranted. I think that's a good thing. My concern would be how deep and broad that would, or how deep that would go. I wouldn't want already populations that have faced some sort of disparities from healthcare providers to get an additional layer of scrutiny from everybody because of what they think they can or cannot be reimbursed on as it relates to the insurance they may or may not have. That's where it's like, yeah, the broad knowledge, but people gonna people, that. And it's like, oh, well, I know this patient may or may not have insurance, or they have Medicaid or something, one of those products, and feels, I shouldn't give this type of treatment, which is wrong all day long, but then add an extra stigma or extra layer of, I won't call it discrimination, but because I feel like it's something that could potentially be added where they do that. I remember I remember years ago, somewhere I worked, it was really about keeping the insurance information away from the provider. It was intentional. because they felt that then that the care and the treatment to the patient would change with that knowledge. I don't know what happened to all of that, and of course I'm no longer with the organization. That was years ago. But I just remember. I just remember they were really. They don't need to know that. They need to know that this, that, and the third.
Right. I'm not saying that everybody needs to know what type of insurance people have when they come to the hospital, but they need to know what part they play in the revenue cycle while that person is in the hospital. And in terms of insurance, there are doctors who don't take Medicaid people. There are doctors who don't accept Medicare. So it's already a level of discrimination built into the system because this entire world, and well, in this country, the entire thing was built on discrimination.
I get that. I get that. But for those who take them all, I would hate to see that additional information and knowledge exacerbate that. That's all I'm saying.
Right, but I'm not. But that doesn't have to be the knowledge that they get to be trained on a revenue cycle. They can be trained that at this level you are at, because there's there's levels to the revenue cycle.
Mm-hmm.
This is where you fit in.
Yeah, I think that they definitely need to have knowledge of what that whole system looks like, what that revenue cycle looks like, and where they play in getting from A to B. Oh, definitely. Everybody should have information regarding that. I agree with that.
I'm not saying that they need to disclose insurance information, but I think that I think nursing, because your documentation does affect it. Like doctors' documentation affects it, so they need to know that your documentation is crucial in this aspect. So you need to make sure that certain things are documented all the time in a certain way. Because case in point, like I was doing a review, and the person had a sacral ulcer. Believe it or not, nobody documented except for the ER nurse. Nobody. Now, if I had when I sent that case off, if I had put an N for not present on admission, we know what that does.
Mm-hmm.
But because she documented, then I could go and query the provider to get them to document that that is a diagnosis. But if she hadn't done that, you can't do anything. Then you got to pay back all that money eventually.
Well, I think that's a conversation about quality documentation across the board. It shouldn't matter. Your documentation should meet a certain level or standard across the board. Period.
And people shouldn't drink and drive, but they do. So you still have, like, we know in a perfect world, we know all this would be seamless, but it's not a perfect world and it's not seamless. And all I'm saying is that there needs to be some accountability and there needs to be some responsibility by the people who run these vast institutions and these vast organizations.
Mm-hmm.
They need to take a more hands-on, a more we can do better approach.
Mm-hmm.
Rather than these, well-crafted emails that really say
nothing. Mm-hmm. Mm-hmm. Well, I hope. well, I hope Dr. Wylesia lands well. I hope everything works out for her in her future endeavors. I just hate that they did this I felt some kind of way that they did this during Hip Week. And even if it was her choice or whatever, I just thought, why during this time? It's supposed to be a celebration, right? So, and you're hip stars and you're all of those things, but why now? I felt some kind of way about just the timeliness of the announcement.
But it's like I told you, I already thought she was going on.
Well, I know I'm involved, so I know she wasn't.
I mean, I just as they say, I can't tell. I really just want. It is a wonderful, wonderful industry. It truly is. you can do a lot. There's so many ways that you can really, really, really make an impact in healthcare in some aspect of HIM. It is a great, and especially for somebody who has a clinical background like I did, it is a wonderful transition, and you really get to see healthcare in a whole different way, and it's amazing. But it is a broken machine, and somebody has to step up. And I really think that if these coding organizations put more pressure on these physicians, then I really think, but it has to come from the top because that's just like as like nurses have the Nurse Practice Act, where we can say, oh no, I'm legally I don't have to do that, or legally I'm not going to do that. I think that people have to. There's a difference between a code of ethics and legality, and I think that that needs to change too. I think that there needs to be more. There needs to be more teeth put behind um, coders making a stand. And I think that there needs to be, because there's such a time crunch because everybody's focused on money. And I get that you want bills to be submitted in a timely fashion, but you can do you can have data analysts do in a week. They can tell you where the bottleneck is in that process. It don't take them long to figure that out. Then it's like, what do you want to do? And at the end of the day, what it really, really, really all boils down to is nobody wants to hold anybody accountable. That's really it. That's it, and that's all.
That's true. That is true. Um, yeah, I mean, there's plenty of work to be done in healthcare in various aspects, and I think which is why folks just need to be involved. Folks need to be, and there's only so many people who are involved, who speak up, who try to advocate for change in the profession. And I understand that folks may have done those things in the past and hit a brick wall or hit a gatekeeper or hit whatever, but there's still opportunities. There's still places where people can still kind of poke the bear, if you will, to try to move the profession forward. Just helping and working out and trying to make the profession the greatest or the best that you know me, I'm eternal optimist. I heard this I heard this today, a realistic optimist, but optimist nonetheless. Where you keep advancing, you keep pushing, you keep speaking up and unfortunately, I think and I'll use AHEMA as the example since we started talking about them. We're so broad. We spread ourselves so thin that you know not the members per se, but the organization, that I think oftentimes focus have gotten away from the members. One, because members don't engagement in some of these organizations is very, very low. You have some wonderful organizations where they get a lot of their members, they participate, they're involved, but in a lot of them it's not. Folks want you to support and rah, but then they don't want to put in the work to do the same. And so I think while they have the organization for the members, then they begin to focus on the stakekeeper or the stakeholders, and then the stakeholders, quote unquote, kind of turn the head, or the neck that's turning the head. And so that's why you see, oh well, now we're talking about this and we're talking about that, because that was kind of stakeholder driven and not necessarily member driven. But you're not hearing from the members, so you think everything is cool, and we don't hear nothing. We're gonna keep flowing in the direction that we're going. I just
But at the same time, that if you don't have engagement, there's a reason why. And I think that once again, the onus is on the organization, because they should reach out to. They know what states have the least amount of engagement. Reach out to those people and ask them, okay, you're certified. Why aren't you engaged? and be ready for the feedback. Because I can tell you, my AHIMA organization here in Pennsylvania, I want no parts of it, because the state president was the director of the school of the college where I was tutoring, where she had somebody who was not even a coder teaching ICD-10C advanced, ICD-10 and PCS, and beginner and advanced. Wasn't certified at all, and was teaching all the wrong things. So what do you? And the thing is, see, and I know me. See, I couldn't go into a meeting without a call her out, because I called her out when I was working there. And I, because when I made a complaint, next thing I know, she's on my LinkedIn page. And we had a meeting. I told her, I said, I saw you on my LinkedIn page. That's the only thing that had premium was really worth, in my opinion, because I called her. I asked her, I said, you're on my LinkedIn page, looking at my credentials. Did you find his? Since you were looking, since you playing Carmen San Diego?
Oh my God.
And it was crickets, because he didn't have any. And you call, and this is somebody who has a PhD. They calling her doctor. You ain't crap. Because you're playing in people's faces and taking their money. You got some nitwit teaching somebody, and then you don't care. And I told her too, you don't care because it's mainly Black and brown women whose money you take.
Okay, breathe, sir, breathe.
That's why people don't engage. Nobody crap. And anybody calling somebody out, that's really it.
Well,
that's why I thank God every day for the Coding Nurse LLC, because they not ready.
They not ready. And that could be your way of advancing the profession and making sure that
I don't mean to cut you off, but I figured it's taken me a long, long time. I don't need to be on this end. I need to be on the end where I need to work for the government, where I can nail these people. Because they ain't following the rules. I want to be able to be the reason why you got to pay back $10 million. I want to be the reason why you PMC and all these people that keep got to pay back all this money and stigma. I want to be the reason why you got to keep paying more. That's what I want. I want to hit them in the pocket.
It's personal now.
It really is. They have run about.
Wow. Yeah. So that's Hip Week in a nutshell, huh? That is Hip Week in a nutshell. Let's see. Barbara had a question. Have you heard any more about AHIMA going away from Pearson testing centers to online testing in the time frame? Yeah, I think we talked about that a while back. I don't remember the time frame. I would have to I'll have to look, but I remember they made there was some sort of announcement or something that talked about their testing. I have to take a look. Do you know, Mr. Jesse, off the top? I don't remember.
That right there is another direct response of responding to the market. Because they want to come up with that because now AAPC, all their testing you can do from home. So it's more convenient. So, and I like the AHIMA system myself because, it really is. They've had breaches in other countries, but I don't think they had a breach of the system, in the United States. And I don't think, I've never heard of one. So I like the testing, having to go to Pearson because it really is a controlled environment.
Yeah, I like the testing centers because I hear people who have sat for those online AAPC exams and they are the blues. They are not. It's difficult.
And I know somebody who had to take their test over because there was some glitch in the system and it shut down. And when it came back, they couldn't. So they had to take the whole thing over. That would be nerve-wracking to me.
Yeah, I would not be a happy camper at all. At all.
But that decision is in response to competition, and I think that needs to carry over into everything. Everything needs to be in response. Well, this person is doing it better, so we need to step it up. And it's not as hard as people think it is either. You just need courage.
Mm. Yeah. Okay. Okay. Well, I think this was good. We got some things off our chest.
Well, that ain't the half. I think I need a therapist.
Well, you've conquered that first step. You were acknowledging awareness is always good. Oh my goodness. Let's see. I guess next week we'll talk. There was a couple of things I saw. My friends over at the AMA, they were talking about digital minimalism. That's going to be a new coin term that you probably see them talking about, on top of the administrative burden and all of the things. They're now kind of floating this digital minimalism term. And
compassionate sacrifice. You can't leave it.
Oh, compassionate sacrifice. And the other around the around the digital minimalism, they were talking about like the pings that they get in emails. And the first thing I thought about was CDI and queries and all of those things. And so I guess that'll be part of their fight. Well, the one thing I can't say about the AMA, boy, them doctors must got a lot of money, because they over there fighting everything and everybody.
And you know how many doctors are actual elected officials, like senators and representatives?
There's a lot. And that's how they get their stuff off. That's how they get it off. Or not. To do what? No, but yeah. I mean, they do have. I know, at least here there's a health committee or health. There's something related to health and healthcare, and I would imagine that other states have some sort of committee around that as well. But how far and deep it goes, I'm not certain.
I'm talking about elected officials. Like, we even had.
That's what I'm talking about. We elected. There's a whole. In Congress. Yes, there's a committee. There's some sort of committee like that deals with healthcare information and issues. So those healthcare people lobby to those folks that sit on that committee.
I get that, but that's not what I'm talking. I'm talking about elected officials who are senators and.
I am too. Those senators are part of the committee of the healthcare committees for the government, for across the board.
I hear you, but we have no senators or representatives that I know of who have an RHI.
Oh yeah, I agree with that. I'm just saying, but those medical folks oftentimes plug into those healthcare ones, and then there's the gatekeeping thing there, because you got physicians who are in those positions to be like, no. Think about the whole play with nurse practitioners. If you got physicians sitting in that power position, that may be one of the reasons why you can't jump that hurdle, or one of the reasons why they make it difficult to jump that hurdle in a particular state. That's all I'm saying.
And right. And we talked about that when we had the Vita on. Like, the nurse practitioners national organization, they are heavy into lobbying and advocacy. That's why we see the tide turning in these states with full practice authority. Mm-hmm. And that's why the AMA is on their smear campaign. But speaking of the AMA, if we're going to talk about that next week, I saw an article somewhere on LinkedIn where the AMA was talking about a lack of medical coders. I'm like, what? And I actually looked at it, and it was on the AMA site. I'm like, well, what are they trying to do?
Uh-oh. Oh my God. Here we go. Exactly. Oh yeah, we gonna be discussing, be like, oh Lord, are we gonna be part of the fight? Are we gonna be on a good part or a bad part of the fight?
Look, it's probably gonna be a bad part. They probably gonna fuss about all these queries that they get. Okay, well, sir, ma'am, you wouldn't get a query if you document it properly.
Yeah.
How about that?
How about that? How about that? Because coders can only code what they see. What's documented.
Exactly.
Wow. Wow. All right. All right. All right. Well, with that, let me just ask, was the tea spilled today? Was there tea spilled today? I know there was some breathing exercises that need to happen, but but yes, it was.
It was. And I think all the time, I really appreciate you for creating the space, and people who come here, they get the truth. Like, because too many people are making it fluff, and it's really not what people don't understand what it is like when you're actually on the job,
Mm-hmm.
and you see the shenanigans,
Mm-hmm.
and you see how people clearly don't know the rules and they're not enforcing them.
That's true.
And they want to, and they present it like it's something. Like, people need to tell the truth, and this is why, parallel to nursing. This is why people, why more nurses now are leaving the bedside not even 2 years into it, because it's misrepresented. Like, that's not what you do in school. Is not what you actually do in real life, and it's a real game.
Right.
It ain't. You could really do some damage, lose your license, and end up in jail, especially nowadays.
That's true. That's true. Yeah, but we're going to tell it. And again, this is a conversation. So we want you to be involved and join in on the conversation. We would love to hear your thoughts as it relates to that. So if you're watching the replay, feel free to put your comments in the chat. We monitor them. We comment. And we could definitely, put give some feedback to your thoughts as well. So thank you all for joining us this Saturday morning at the Saturday Morning Tea. If this information was valuable for you, help us share this message with others by liking the video, sharing the video, and of course, subscribing to the Professional Reimbursement Network YouTube channel. You can also check out the Coding Nurse channel on YouTube and subscribe there as well. There are some gems, as you can tell by the passion in Mr. Jesse's voice. There's some gems over there as well. Last but certainly not least, to my Clubhouse folks. Okay, wait, I don't even see the little green thing at the top. Okay, I won't even say that because I don't know what's going on at Clubhouse. I'll give you more information about Clubhouse, but join the house, I guess. I guess that's what it is. Join the house. The Certified Marketable Medical Coder house on Clubhouse. And you will get notified of our live broadcast on Saturday morning at 9 a.m. Eastern Standard Time. Again, this is a great session. Lots of knowledge going on, lots of passion and advocating, and just some things to really think about. Hopefully you walk away with some food for thought on what you individually can do to make our profession better during this close of Health Information Professionals Week, being the hip star that you are. I should have coined that myself. Thank you all again for joining. And remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care.
Talk to you backstage.
Okay.